So I'm Stacey. I'm the ward manager at Alder unit at Callington Road Hospital. So we are a 10-bedded inpatient rehabilitation unit. So we take men and women from across Bristol, and we take referrals from other inpatient units in Avon and Wiltshire Trust and offer treatment programmes. So my role is a ward manager, so I manage the team, so I'm leading the team, so I deal with all the referrals that come into the unit, so I will be part of that assessment process. So in a sense I determine who comes and has treatment on the Alder unit. I'm involved in family work for psychosis as well. That's a service which Bristol Mental Health incorporates as part of their treatment. So I do family work with families, not just on Alder but across Bristol. I'm also a carers lead for Callington Road, so I work a lot with carers and work in conjunction with partnership organisations to run carer support groups across Bristol. So the service is based on 4 main tenets really. The type of person who does come to Alder unit will have a severe and enduring mental health problem. So really it's a condition that you have to learn to adapt to live with. So interventions are, firstly, there might be some medication involved. Secondly, we would look very much, the service is based around structured activity as being the bedrock of how somebody copes in life with their particular condition. So we'll be looking at interests of that person and trying to promote that with them so that they can become engaged in activities which gives a structure to their lives. So we do a lot of psychosocial work, a lot of CBT work, problem solving on what works and what doesn't work for that individual. We also like to involve families, so we work a lot with the Triangle of Care as a collaborative approach to treatment. So mental illness doesn't just happen to individuals, it happens to families, so we like to involve them as much as possible in the treatment plans. So care plans will be built around assessment. If you were referred, we'd come and meet you and assess if we felt that we could offer a service that would be beneficial to you. If that was yes, then you would be admitted to the unit, and it's a very kind of family-orientated, friendly unit. So we value sensitivity to people, respect to people, and we want people to have self-determination in their treatment and how they go about recovering from their illness. Yeah. So we'd be very welcoming. So we have a multidisciplinary approach, so we have a consultant psychiatrist, we have a group of nurses who work 24 hours a day, we have psychologists, art psychotherapists, occupational therapists, and we have a vocational instructor. So a varied background, and obviously when people do move on, we refer to social services, so people will be allocated a social work as well to work with them. Best part for me, and I'm a bit long in the tooth, is forging those relationships with families, clients over a longitudinal period of time, because I get to know people really well over a number of months, and often I will see them throughout the years. So that really is the best part of the job for me, is working with people, getting to know them and trying to help them. Yeah, I do. I mean, I've already mentioned that I work with carers organisations across Bristol, so that's Bristol Care, at the Bristol Carers Centre, at the Vassal Centre in Bristol. I also work very closely with the Rethink Mental Illness, and I help work with an educational course run at Bristol College in conjunction with Rethink Mental Illness, where we run 3 or 4 times a year a course for Coping and Caring for Carers, which runs over 6 evenings a week, 3 times a year. Yeah. And we cover all aspects of caring and the difficulties and what would be helpful, and talk about boundary setting and things that people bring to the course really, and have questions around. I go for caring, I'd go for compassionate, and I'd go for challenging.